Thank you, Clancy. As Clancy said, my name's Rachel. I'm here to speak to you about physiotherapy. Hopefully I'll be able to answer most of your questions in the presentation, but definitely raise your hand if there's something that doesn't make sense or you're wondering. And you can also come up at the end of the session to talk to me as well if there's something specific that you wanted to ask. So, is everyone awake this morning? No. Well, everyone can stand up. You answered no. All right. 5 jumping jacks from everyone. All right, sit down. You're awake. See, now blood's flowing, everyone's ready to listen. So what is physiotherapy? It is a primary healthcare profession. And basically what that means is that anyone can walk in off the street to receive physiotherapy. You don't have to have a doctor's note in order to come. That happened, in the past 15 years, and that's now changed where anyone can receive physiotherapy at any time. Physiotherapy is a health service which helps to attain and maintain health. And that's not just the physical aspect. A lot of people say, well, I hurt my hand or I, hurt my elbow or something like that. How can I get better? But it's also, a lot of people's quality of life is really changed after an injury. If you can't work for, let's say 3 or 4 months, that really takes a toll on your emotional health as well. And so I let a lot of people, try to just vent and kind of, learn ways to adapt how they are coping, and I'm helping them to just kind of realize that there's more to life than maybe just their hand. Maybe they need to learn how to adapt differently, and so that's what I'm trying to teach them and help them cope with when there's a big life-altering change to their life or their career. So physiotherapy maximizes mobility and function to improve quality life, just as what I said. A lot of the time that's what's altered with the mobility and the function, and then that can take a toll on kind of the emotional and spiritual aspects of your health. Physical therapists also collaborate with other clients and healthcare professionals in order to provide client-centered services. So basically what that means is that it's the client that's the center. So if you think of, a dot in the middle of a big circle, the big circle is all the healthcare professionals, all the environment around this person, but the person is right in the center, and it's not my own personal goals that I think that they should be able to do. So for the example I gave yesterday was, if I think someone should be able to run 2 miles a day, well, that's my own personal goal. It shouldn't be what I think. If the person just needs to walk, a couple of blocks just to be able to walk to and from the grocery store, then that's their goal, and that's what we have to attain. It's not, okay, well, if you walk this much further, it's going to be better. Well, if the client isn't going to do it, then it's kind of tough as well. So it's all about what the client is. And so physical therapy has a really wide range of clients that we see. So when I was working at St. Boniface Hospital, a lot of the time the goals were, can this person sit to stand on their own? Do they normally use a walker? If not, we have to get them stronger so that they can maybe only use a cane for when they go home. So it's returning home from the hospital. Maybe it's returning back to work, as I mentioned before about seeing clients through WCB, and let's say they hurt their back and their job is to lift a lot. Well, it's about changing our goals in order to get them back to work. And then a lot of you guys probably think a lot about the returning to sports and activities, getting back to, provincial volleyball or running track or something like that. It's all different specific goals for each client. So who's in the healthcare team? So there's the occupational therapist. They look at various equipment to help our clients with assisting with daily living activities. And that could be anything from a rail beside the tub to get into the shower safely, to having a reacher to help pull on someone's socks, to having a specific handle on a steering wheel for driving. So they're looking at the equipment stuff. There's the doctors, obviously, to treat underlying medical conditions. They also prescribe medications. The pharmacists then review and correct those medications, and they give a lot of education to the client about the benefits or the side effects or the risks associated with those medications. And then the nurses would provide direct patient care either in the hospital, through home care at home, and that sort of thing. And then, of course, there's a patient, and they're part of that healthcare team. Even a lot of this is for in the hospital setting where physiotherapists work, but even in the private care setting where I work, for example, I was referred a patient who had a locked jaw, TMJ, and they could fit 2 fingers in their mouth. That was it. They couldn't take big bites. They couldn't, it was painful to chew, even to talk and sing. And so her goal was to be able to open her mouth so she could sing. And so the dentist referred the client to me. I worked with them. I did acupuncture into the face, into the jaw to help release that. I worked with my hands to kind of help mobilize the joint. And then I actually referred her to a chiropractor as well who specializes in TMJ things. So there's 3 different healthcare professionals helping our patient get to that point. And she is improving. I've only seen her maybe 3 times or so. So she's able to open up her mouth more, but she hasn't told me about the singing yet, so we'll have to check in with her. Stay tuned for next year. Okay, so what do? I'm a clinic owner in Toulon, Manitoba. The rural setting is a lot different than in the city, just because in the city here, there's lots of clinics. You drive down Pembina and you're gonna see a handful every couple of blocks for various things. So there's, a sports injury clinic, and then there's a hand therapy clinic, and there's, a pain clinic, and that sort of thing. In Toulon, I'm the only physiotherapist there, and so I see any injury that comes in. So it could be anything from an ankle sprain to a TMJ to a low back injury after a car accident. I'm seeing a really wide variety, and so I'll see clients with AutoPAC and WCB claims, and then any type of injury from doing a household chore to playing in high-level sports to gardening, that sort of thing. So all those things can cause injuries, so they come to me. And then my job is also to promote physiotherapy through my own lifestyle, whether it be just taking the stairs rather than the elevator, or trying to play some sports myself. I also do some volunteering on various committees and councils that are part of promoting physiotherapy in Manitoba. And then I do presentations here at the Rotary Career Symposium, and then within Toulon itself, just to teach people about what physical therapists do, what maybe a few key stretches would be to do for someone who works at a bank, who sits at a desk all day, who does lots of lifting, all those types of things. So a normal day for me would be to see, I see clients every half an hour, and I would do one-on-one time with them, teach some various exercises for their specific injury. I'd work on massaging and kind of trying to help mobilize, let's say, their neck or something like that to help make it feel like it's a little bit better. Put on various machines that help with reducing pain, like TENS or maybe even an ice pack or something. And then acupuncture as well, I would do on clients who I thought it was appropriate. So The benefits of a career in physiotherapy are numerous. These are kind of just the top 4 for me. The biggest thing when I opened my clinic was that I could be my own boss and I had my own flexible hours. So, for example, today I normally start at 9 in the morning while I'm here. So I just flexed my day. I start now at 12:30 and I'll work into the evening as I need to with seeing my clients. When there's no clients there, I'm usually not there. I just I book my clients together. I'll work for 6 hours or something like that, and then I've got my charting and my admin work accordingly. So the biggest thing for me though is to help people. I find that I think that I'm making a difference in someone's life, whether it's getting back to working or now that they can go back to whatever sport that they were doing. I think that it's about improving the quality of life for my patients and trying to help with preventing a further injury after they've, come up with or they've been injured after something else. In terms of salary, there's a really wide range of salaries as well. For example, in the hospital, if you're just starting out, you're making anywhere from $28 to $30 an hour, which correlates to about $45,000, and then you get raises accordingly with each year of experience that you gain. With working in a hospital, you're given healthcare benefits, you are given set vacation time, you'd be given mat leave, all those kinds of other benefits that would be associated with that. In a private healthcare setting, there's no mat leave, there's no healthcare benefits. If you take time off, you don't get paid, and your salary depends on whether or not clients come in. It's on a commission basis. So if you have 4 people coming in 1 hour, that's $52 per client. So that could be $200 in that hour, but maybe you wouldn't see anyone for another 2 hours. So it ends up kind of evening itself out that way. So now it's your turn. So now I have a bachelor in physical therapy, but it's now going to be a master's in physical therapy. And so what that means is that you can take any degree you want, and then you would apply to the master's program. So any university degree. So if you want to take math, if you want to take kinesiology, if you want to take music, if you want to do English, you can do anything you want. There's just specific prerequisites that you will need to take, which I'll talk about in a little bit, and that's just to get into physical therapy. Usually university degrees are about 3 years. So in terms of high school prerequisites, there's no specific prereqs for a degree in physical therapy. However, chemistry, biology, physics, pre-calc, applied math, and English are the courses that keep all of your doors open, all of the options to take any course that you want in university. These ones just help to make sure that you have all your bases covered. If you don't have physics, well, then maybe you can't take physics in university, but if you have your chemistry, for example, if you don't have your chemistry in high school, you can't take university biology. So there's just a few things that are kind of tricks of the trade that I just took every course to help make sure that my doors were open. So that's just kind of what's strongly recommended. In terms of the university prerequisites, with your general degree, these are what are required for entering the physiotherapy program. So sociology, biology, psychology are the 3 main ones together, plus you have English, that written component, you have your math component for stats. There's also human anatomy and physiology, which is kind of an obvious one to learn about the muscles and the attachments and blood vessels and nerves that are supplying these muscles and all the bones and that sort of thing. And then you have human development as well. So it's, I kind of get a little bit on a soapbox here about it's not all about school. You don't have to sit in front of a desk 8 hours a day to make sure that you get the highest grades possible. A lot of the things that the interviewers at the School of Med Rehab want are to see the well-rounded individuals. So, volunteering either Well, volunteering with a local physiotherapy clinic is really good because you can see how a day-to-day routine goes. You actually get to see a physical therapist in action. Volunteering for other things, at a choir or your church or wherever, those are just really key things that you might want to, that people want to see when they're interviewing you. The School of Med Rehab, there's an open house that they host every January, and it's nice. It was really validating for me once I was in school to go see where would I be studying, where would I do my labs, where would, are these my teachers? These could be potential classmates here in the room. So there's always definite points that you want to do every year or especially prior to getting in. So I need some more coffee here. So as I mentioned, it's a Master's of Physical Therapy. So you'll earn a 3-year degree prior to applying. They take the top 75 people based on GPA alone. So minimum GPA would be like a 3.18, which is around a B, and then anything higher. So if you're in a really competitive group, you might want to have a higher GPA than that to ensure that you're selected as the top 75. There's a hands-on interview process called a multiple mini interview. And basically it's 8-minute sessions where you are put into a scenario where you have to either interact with a patient, with family, with a student, that sort of thing. And it's they're trying to see your kind of characteristics, how you interact with people. Are you introverted or extroverted? Are you a take charge kind of person? Are you trying to be a problem solver? These are types of qualities that they're looking for in these interviews. Once they have, once the interview process is done, they take the top 50, and it's a 2-year master's program. Tuition for that is about $8,000 per year, and it's an integrated program including your practicums, and it would go almost 2 years straight. There's maybe a month off in between because they're trying to fit in a 3-year program now into a 2-year program. So they've changed a lot of that. Physio school, as I said, is 50 students in the class. It's basically, you learn everyone's name, you know a little tidbit about every single person in your class, you learn where they grew up, you know a lot about these people, and they end up becoming lifelong friends. I actually married a guy from my class, so obviously, you get to know everyone. So you have experienced physios as your teacher. They're the best in their field. Almost every teacher has won a really prestigious award within Manitoba and even across Canada. Some of them are published with their research and with their masters and with their doctorates, and so they're the best in their field, and they're just teaching us, and you actually get to know them, you get their emails, you go out for coffee with them. It's pretty neat how you get lots of those opportunities to meet the best in class kind of thing. So there's the classes, you have the labs to practice on each other, on standardized clients, you're practicing with physiotherapists who are observing you, you're in the hospital, you're in clinics, there's lots of practice to become a really good physiotherapist. Within the school, there's also, social committees, there's events, there's student councils, there's integration with the other programs. The School of Med Rehab is consisted of physical therapy, occupational therapy, and respiratory therapy. So you get to know a lot about those other professions, and you kind of get to start your integration with that as well, especially since we're going to be working closely with them as part of that healthcare team I was talking about. But there's endless opportunities. As I said, like Winnipeg, there's a lot of physical therapy clinics, but that means that there's lots of jobs out there. Hospitals are always needing more physios as physiotherapy is gaining more and more popularity, and so it's definitely something that it's not going to die down. People need their health to be taken care of, so it's not a profession that's going to just halt and no one's going to need physiotherapy anymore. Obviously, I had the opportunity to open a clinic within a year of graduating, and so that was my opportunity the rural setting provided for me. So this is the website that I would strongly recommend. If you are interested in physiotherapy, this is the place to go. This has anything about the courses that I talked about earlier. How many credit hours are they? What prerequisites do you need for them? Here's the questions about the multiple mini interview. Here's other things about occupational therapy or respiratory therapy. This is the place to go.